Hey everyone, thank you for joining us. Go ahead and get your questions ready. We're going to have a wonderful session tonight talking about body contouring procedures and plastic surgery. Let us know where you're tuning in from as well. And please go ahead and share the link with your friends, especially those you know who are wanting to have surgery and who are interested in gathering some information. We're going to be talking about plenty of procedures tonight, including the mommy makeovers, breast augmentation with implants, with fat transfer. We'll talk about liposuction, lipo 360, arm lift, thigh lift, body lift, surgery after massive weight loss. So plenty of different topics here. We're also going to be talking about how to get ready for your surgery, what BMI we recommend, and we definitely want you guys to be informed and contact us so we can take care of you. Put in your information in the bottom left of the screen there. There should be a form so that we can contact you and guide you through the process. All right. Starting us off, Sienna, is a mommy makeover considered body contouring? Yes. So body contouring is a general term to pretty much what it says, contour your body. So a mommy makeover is a combination of multiple procedures. Typically will include something done to the belly area, usually a tummy tuck, and then typically breasts as well, or maybe some liposuction, fat transfer, things like that. Different patients will have different mommy makeovers depending on what really bothers them. But usually, for the most part, it includes belly area, breast, and then anything else. But body contouring is a general term. All right. Let's see here. Other people are connecting. Go ahead and keep connecting. Go ahead and also share the live with your friends and ask your questions. Don't be shy. For the typical mommy makeover, so I do the drainless tummy tuck procedure. So with the drainless tummy tuck, you're actually able to recover a lot faster and much smoother than the traditional tummy tuck where they actually put drains in. So it kind of accelerates your healing process and puts your head in the game there. Combination of procedures for, like we were saying, the mommy makeover usually will be the drainless tummy tuck and some type of breast surgery. Most women who have had pregnancies, who've had children, who've nursed, they will complain of some descent of the breasts and some sagging and also loss of volume. So typically for them, what we will do is, in addition to the drainless tummy tuck, we will do a breast lift plus or minus a breast augmentation. Now, some women will want to have the augmentation with breast implants. Some women don't want to have breast implants. And so we'll do the augmentation with their own fat. So we'll do lipo 360 to contour the body even more and also collect that fat and then transfer that fat to the breast area. So a combination of a breast lift and breast augmentation with fat with the tummy tuck and lipo 360 will be their mommy makeover. Some other women may want, in addition to the tummy tuck and the lipo 360, they may want to fill in their hip dips and the butt area. So get a BBL, which is a Brazilian butt lift. So that's also another type of mommy makeover. We tailor the procedures based on our patients and on your needs as well. So some people may actually need a full body lift, which is a combination of the drainless tummy tuck, the mons pubis lift, the hip lift, and the butt lift. So the scar goes all the way around the belt line. It's like a 360 tummy tuck. And that really helps to get rid of that saggy skin and loose skin that is typical, especially once you've lost a lot of weight. Weight loss coach is asking, which one is safer? Okay, so both the traditional tummy tuck and the drainless tummy tuck are safe, but the drainless tummy tuck makes your recovery a lot easier. With the drain, so the traditional way of doing the tummy tuck, you place drains into that area where we operated, right? A lot of patients, if you pull those drains too soon, will develop fluid collections known as seromas. That can also lead to infection. When you do the drainless tummy tuck, you don't put any drains, because when I close everything up, there's very, very small areas where the fluid can collect. So that really automatically erases the need for drains and decreases your risk of those fluid collections and infections that can occur from that. So for me, and for my patients, the drainless tummy tuck is a much better option than the one where you have drains. And then the drainless tummy tuck is applying a concept. And I use that concept in all of my surgeries. So when I do a breast lift or a breast reduction, even a breast augmentation, I don't use drains. There are some surgeons that still use drains for these procedures, but I don't. Unique Queen is asking, what about J-plasma? Yes, I use J-plasma in patients who have the potential of having some loose skin, especially when we do the liposuction. If you don't have a large amount of saggy skin around, say, for example, your bra line area, love handles, your thighs, or even your arms, we can do a liposuction. And instead of having to do, for example, the arm lift where you have the scar that goes from the elbow all the way to the armpit, if you have a little bit of loose skin that we feel is not enough to really warrant that scar, what we'll do is we'll treat it with the J-plasma. And that helps to kind of tighten it up without having the scar. So it gives you that skin tightening. ALPLCLH. Hi, question. Which one is better and cheaper, a pannis or tummy tuck? So good question. Let me just explain the difference between the paniculectomy and the tummy tuck. So a paniculectomy is a limited version of a tummy tuck. When you do the tummy tuck, when I do the tummy tuck, I'm including the paniculectomy. So the paniculectomy only removes the overhanging skin below the belly button, the overhanging around the mons pubis area, so the fupa area as well. That's all that the paniculectomy does. It removes that bar, that apron of skin on your lower belly. It doesn't fix your separation of muscles. It doesn't move your belly button. It doesn't take care of the upper part of your belly as well, and it doesn't make you all nice and tight. The tummy tuck encompasses all of that. So in the right patient, the tummy tuck is the gold standard. It gives you the best results. Vicky Ayisu, when you do fillers on the face, how long does it take to do the procedure? It could be around 20 to 30 minutes, but we have to numb you, so it takes a little bit longer. It takes about 15 to 20 minutes for the numbing cream to take effect, and then we go ahead and inject you. So the whole process for fillers in the face will probably be around 45 minutes to an hour. So you just want to schedule that for your appointment and treatment. Bars Jess 0. I have quite a bit of loose arm skin. What would you recommend for me? I've lost a little over 80 pounds. Congratulations on your weight loss. Based on that, I would recommend an arm lift. So contact us if you'd like for us to take care of you, and we will guide you through the process and get you on the schedule so we can take care of you. Three SNAX. Is there a diagnostic test to check for failed muscle separation? You can do a CT scan or an ultrasound, and that will visualize the ab muscles. and you can tell and measure and see how far apart they are. So if you've had a failed muscle separation, then there will be a visible gap between the muscle edges with your right ab muscle and your left ab muscle. Another way too is also just palpation. So on physical exam, sometimes when the separation is quite large, we can easily feel it and know that there is a separation of the muscles. So I would say consult with a board certified plastic surgeon who can examine you, palpate everything. And if it's not obvious, then imaging studies can help you determine if the repair failed. Martez. Okay, so that question just disappeared. We'll get back to you. Sophia, how long the mommy makeover procedure take? Okay, so how long does the mommy makeover procedure take? It all depends on what you have on your procedure, because the mommy makeover varies by patients, but on average, it's around 6 hours of surgery. It's a same-day procedure. You get to go home the same day once you wake up from surgery. Janine Walker, what's the pricing for an arm lift? I don't have the pricing with me. Contact my office. Put in your information in the bottom left of the screen. We will reach out to you and give you an estimate. Also, write down the phone number, 281-724-3138. And you can definitely call us or text us, and we'll be happy to answer your questions and get you some information on pricing as well. Martyr 6769, how do you feel about endolift procedures? I don't feel like those actually last. They don't provide long-term results, so I don't do those. All of those types of procedures, I feel, fall short of the actual surgical procedures that will give you much longer lasting results. So beware. Weight loss coach. I want lipo and a tummy tuck, but I'm clueless to this. Okay. Contact us. We will be happy to guide you through the process. We definitely need to get some more information from you. So kind of like your height, weight, your medical history, any surgical history, any surgeries you've had before, what your goal weight is. You know, there's a lot of information that we need to get and go through. And in a consultation, if you're in the Houston area, I'll be able to see you in person and examine you and then decide which treatments will actually be beneficial for you to get you the results that you're looking for. If you're out of state, out of town, you can't come into Houston for an in-person consultation. Hey guys, thank you for joining us on YouTube. I appreciate that. Ask your questions. Don't be shy. If you're unable to come in person, then we will start with a virtual consultation. $. If I have, like $1 million maybe. If I have had cavitation lipo and RFTM, am I still able to get lipo and a BBL in a year or so? Like radio frequency treatment, is that what RFT is? It depends on how much loose skin you have, what you present with. So definitely see a board certified plastic surgeon who can examine you and see what the best treatments would be. If you have a lot of loose skin, some separation of your muscles, and you're a candidate for a tummy tuck, then yes, you can get a tummy tuck. 3SNAX, muscle rep. Muscle rep. I think you were asking about the separation of the muscles, right? I'm not sure what you mean by muscle rep. Alicia, hey, is there a BMI you do not pass for surgery? Yes, anything above 35. So for example, if you're 5 foot tall, your maximum weight will be 179 pounds. If you're 5'4", your maximum weight will be 204 pounds. If you're 5'8", your maximum weight will be 228 pounds, and so forth. And you can go online and just Google BMI calculator, put in your height and your weight, and you'll see what your BMI is. If your BMI is higher than 35, put in the weight, that will get you a BMI of like 34, and then look at what your target weight is. Daisy, how long is the recovery process for a tummy tuck? So the majority of my patients who get the drainless tummy tuck, because that's what I do, that's the technique that I do, within 3 to 5 days, they're weaning off their pain meds and they're already walking upright. So you don't have to walk hunched over with drains that bother you and wait about 2 to 3 weeks before those drains are removed. From the get-go, you're already walking upright off your pain meds. By the time you see me the 1 week after surgery, you're typically driving yourself to the appointments, and then you're back at work after that first appointment. If you are, as long as you're not doing any kind of heavy lifting type of work, you'll be back at work very quickly. Back to the gym around 2 to 3 weeks, doing some aerobic activities, and then heavy lifting or light resistance training at 6 weeks, and then heavy lifting at 2 months. Martyr 67, 69. How do you feel about endolift procedures? Okay, I already answered that question. Like I said, it doesn't seem to stay long. Hey, Deanna, how are you? You still in the medical center? I hope you're doing well. You got to give me the news. You engaged, married? Let me know. I hope you're doing well. Thanks for tuning in. Miss working with you. All right, Antoinette. What is recommended on the scar of a tummy tuck, especially for someone with it's not easy to get to the rest of that question. Thank you. Especially with someone with keloid skin. So a couple of things there. One, I would recommend that you go and see a plastic surgeon who can evaluate you, because if you have a keloid, there's another type of treatment for that. I place my patients on silicone-based scar treatment for the healing of their scars after their surgeries with me. And that is a compound product. So you can't go and buy what I give to my patients. It is all made upon order. So I actually put the ingredients, tell the pharmacy, and they actually compound it and then ship it to the patient. But definitely see a plastic surgeon who can evaluate you appropriately and then see what treatment you need. Lori, do you do spiral thigh lifts? There's somebody that asked that previously. So I do the thigh lift based on what your body needs. So for the spiral thigh lift, for some reason, I think this is something, I guess, maybe more prevalent on social media. It is a thigh lift that goes all the way down to the knee. So in other words, when you have a lot of excess skin and fat that goes not only on the top part of your thigh, but all the way through your thigh to the knee, you kind of go with the incision that goes all the way from the groin all the way down to that knee. And so definitely we do that. I also do another type of thigh lift in patients who don't have all of that excess, and that excess is just limited to the top part of the thigh. I keep that scar in the groin area, kind of like a crescent lift, I guess you can call it. So go ahead and put in your information in the bottom left of the screen there. We'll be happy to reach out to you and get you guys in for your consultation and book you for your surgery. Vicky Aisu, about the fillers question, I meant the long term, not the procedure time. So for the long term, it all depends on people. Most patients, it will probably last anywhere to about a year or so. Everybody has a different type of metabolism, so they may metabolize the product faster, but typically it will be about a year. Alicia, I had an umbilical hernia repair as a child. Can I get a tummy tuck and lipo? Yes, yes. As long as you don't have a recurrent hernia, you can definitely get tummy tuck and liposuction. So contact us. We'll be happy to treat you and take care of you. Crystal, for a large sacral fat pad, can I just do lipo 360 only? It depends on what you present with. If you have a lot of fat accumulated that also pushes that skin out, you may need some type of skin tightening procedure and not just liposuction. It all depends on what you present with. It could be just lipo, it could be lipo and a skin tightening procedure. So you have to go and see somebody who can evaluate you and give you the appropriate treatment. Alicia, looking for paniculectomy and a Mons, so like a Monsplasty. So contact us. We will be happy to guide you through the process and get you in for your consultation, and then we'll see what treatments will actually give you the best results. So we'll be happy to take care of you. Put in your information in the bottom left of the screen there, or just call us during business hours. We're in Houston, Texas, so 9 to 5, Monday through Friday, Houston time. Laura Mayes. BSN RNCO, best option for sagging neck Black women. It depends on what you present with, how much sagging skin you have. The short answer would be most likely a neck lift or a combination of a neck lift and a facelift, depending on what exactly is sagging, what is seen on physical examination. So go and see a board certified plastic surgeon who specializes in body contouring, does face and neck as well, and then they can evaluate you. So you're welcome to come and see us. We'll be happy to take care of you if you're in the Houston area or wanting to travel to Houston for me to take care of you. Maria, what's the best treatment for fibrosis? My stomach looks horrible. I tried to do a second lipo but failed. So it all depends on exactly what you present with. Yes. Thank you, Deanna. Doing very well. Oh, I'm very happy for you. My friend just got married in January, so wonderful. You're still at the meds. Excellent. I'm very happy. I am very happy for you. God bless you, and thank you for tuning in. Say hi to everybody else in the crew too, if you're still in contact with them, and I appreciate it. All right, wonderful. Daisy, do you have accommodations for out-of-town patients? So we recommend Airbnb, hotels. We also have recommendations for recovery homes if you would like to go to one. And if you have family or friends, you're welcome to stay with them as well. The way I do my procedures is to make your recovery as easy as possible. You do not need skilled nursing facilities. You don't need a nurse to take care of you. Just an adult to supervise you and help you get around will be plenty. So give us a call and we will be happy to take care of you. One Donna Bad, can you be awake while doing a BBL? I typically do the BBLs with you asleep. I feel like I'm able to be a lot more aggressive and remove a lot more fat, contour you even better, and then inject the fat safer. So I don't do awake BBLs at this time. So for me, you will be asleep. Han Daub. How many times can vasor lipo in 2 months? Can you vasor lipo in 2 months? Okay, so if you've had vasor lipo or any type of liposuction procedure, you wouldn't get it in 2 months. That's way too soon. I would wait at least 9 months to a year to see what the results look like before going and get some type of correction or second type of liposuction. Terry P. I've just had a tummy tuck and an ab repair. 3 weeks post, my lower belly is still swollen. Is that normal? I don't know. I would say go and see your plastic surgeon or whoever did your surgery and make sure that everything is healing well. Weight loss coach. I am 5'6", 225. Can I get a tummy tuck? 5'6", 225. You still have about 10 pounds to lose for you to get to that BMI of 35. So if you would like for us to take care of you, 10 pounds can be typically lost within 6 weeks. So you can come in and see us, put in your information in the bottom left of the screen there. Come and see us and we will evaluate you and then get you ready. And then 10 pounds, like I said, if you want to have surgery anytime between now and the summer, it'll be perfect. Then we can move forward. Kimberly Whitaker. I am 59 plus 60 pounds, but I'm a smoker for many years. Can I get this done? Okay, great question. So age is not really a limiting factor. The smoking will definitely make you not a candidate. You have to quit smoking. You cannot undergo a tummy tuck while you're smoking. It would be horrible. Your recovery will be miserable and you may not actually heal at all. So definitely do not move forward. If anybody wants to operate on you, even though you are smoking, you have to stop smoking. I typically will have my patients stop smoking 3 to 4 weeks before surgery and then 4 weeks after surgery. So you'll be off smoking for at least 2 months. And hopefully that'll be your wake-up call to actually quit smoking because it is it's really not good at all for your skin, for your health, for your lungs, for anything. So as a smoker right now, you would not be a candidate for a tummy tuck. Jatrini 868. Have you ever done procedures on high-risk clients? Yes, I have. So we make sure that those high-risk patients, and I'm not sure what you consider high risk, but definitely patients who have had who have some type of medical condition. Hey, Tropical Exotic Treats, how are you doing? So nice to see you. Ask your questions, okay? And I'm looking forward to you coming in for your consultation. High risk, it all depends on what you mean. So there could be, for example, somebody who has HIV. There's no way you can actually cure that. That's a high risk patient, because if anybody else gets stabbed, poked, or has anything, it is a risk of contamination. Can we do surgery on them? Absolutely. As long as they have the right medications, everything is under control, and there's no issue, and they're cleared by the infectious disease as far as their immunity and immune system function is concerned. Other things are high blood pressure, diabetes, anemia, thyroid problems. All those can put you in a high risk, and also high BMI. That's a high risk patient. We need to bring all of those under control to bring you from high risk to an acceptable risk, and then we move forward with surgery. So that means if you have high blood pressure, we need to make sure you're on blood pressure medication to control your blood pressure. If you've got diabetes, your hemoglobin A1C is 12, is too high. We need to bring it down to 7 or less. So there are steps that we do to bring you from a high risk to an acceptable risk for us to be able to move forward with surgery. KB, do pre-existing health conditions prevent from being able to have surgery? Oh, great. So that's a good segue in what I was saying. So it all depends on what pre-existing medical conditions you have. As long as we can control them and we make sure that there's no lingering high risk or anything that would prevent you from actually being a candidate, we can move forward with surgery. I have lupus. Am I a candidate for mommy makeover? Jatrini 868. I have operated on patients who have lupus, and they have done very well. So it all depends on how severe your lupus is, which treatments you're on, and we will coordinate with your endocrinologist to make sure that you are on appropriate treatments, that everything is good, that you're not having like an active flare-up of your lupus, and then we should be able to move forward. So definitely we'll be happy to take care of you there. Contact us, put in your information in the bottom left of the screen there, okay? 56220, can you get a tummy tuck? Okay, so I answered that. You need to lose about 10 more pounds, which, like I said, is very doable within 6 weeks. So we will be happy to take care of you. Putting your information in the bottom left of the screen there should be a form, and we'll get you on the books for your consultation, and we'll take care of you. Noemi Elena, have you ever had someone have a complication with smoking? So I've seen plenty of complications with smoking when I was in my training, and that's why I do not operate on patients who are actively smoking. You will have high risk of not healing your wounds at all. So if, say, for example, you're having a tummy tuck, right? We have to elevate all of this tissue and put it back down. A lot of smokers will have problems where the bottom part, it opens up, it just does not heal. If you're having a facelift, your skin may slough off and you'll have a big wound and a scar, and it's horrible. We do not want that. So please, if you're a smoker, you have to quit smoking. At least that's a requirement. We also do a nicotine test, urine nicotine test on the day of surgery. If it's positive, we cannot move forward with surgery because it's too big of a risk. Kristen, 44. I'm 5'4", 155. Would I be a candidate for an in-office tummy tuck? So 5'4", 155. That definitely puts you below the BMI of 35. Now, as far as getting an in-office tummy tuck, I would do an in-office mini tummy tuck. So it all depends on what you present with and whether or not you are able to undergo a local procedure. Not everybody is comfortable being awake during these procedures. They are anxious, so they're not an ideal candidate to be able to do these procedures in the office with them awake. So contact us, come in and see us. We'll be happy to take care of you and guide you through the process. So a mini tummy tuck in the office is doable, but in the right patient. The bougie way, can I get a tummy tuck and lips without muscle repair? Yes, you can. You don't have to get your muscles repaired if you absolutely desire not to have it done. I typically will repair the muscles if they are separated. That is just standard. But if you have some kind of objection to that, we will definitely note that in your chart, and then we will proceed with the tummy tuck without repairing your muscles. As long as it's not like a hernia or anything. If there's a hernia, we'll definitely fix that. Okay, so contact us and we'll be happy to take care of you. Putting your information in the bottom left of the screen here, okay? All right. Oh, okay. I think it's not. It's the bougie way. I just answered your question, but I don't think it's lips. I think it's lipo. Tummy tuck and lipo without muscle repair. Yes, you can. Like I said, if you don't want the separation of muscles repaired, we can definitely do the tummy tuck and lipo without repairing the separation of muscles.